The first Triad long-term care facility started vaccinating staff and residents against the coronavirus today. Now, hundreds of people got their vaccination in places like Camden Health and Rehab in Greensboro. WFMY News 2's Grace Holland is live there now with details about how the rollout is going.
One of the residents that was vaccinated here today is 87-year-old Vyra Kivett. She told her daughter that the shot didn't hurt at all and she doesn't have any soreness yet.
I think she's a little, like I say, apprehensive, but I think she's glad to have at least some protection since she's in an environment that tends to have repeated outbreaks.
Camden Health and Rehabilitation Administrator James Detter says the facility has been hit hard by cases and deaths during the pandemic. He estimates 90% of their residents opted to get the vaccine during his first clinic through CVS.
We believe this is kind of the beginnings of light at the end of the tunnel, with somewhat of a normal life coming back in the future.
But not all long-term care facilities started vaccinations today. I called around to several Guilford County facilities. They say they're getting the vaccine later this week. For some of them, others say next week. Some don't know. Steve Fleming is the CEO of Wellspring Retirement and says their skilled nursing residents will start getting vaccinated on January 5th, but there's still not a timeline for independent living residents.
Everybody's hopes get up because they hear a date or they hear, but it takes time. That's the reality about this. This is a big rollout of vaccine.
I reached out to NCDHHS and asked why some facilities may have to wait longer than others. I am still waiting for a response. And facilities vaccinated today through CVS will have 2 more clinics from the company in the coming weeks. And a spokesperson told me that they are going to vaccinate 900, almost 900 different facilities across North Carolina.
Grace, thank you. The state plans to roll out the vaccine in 4 phases. Healthcare workers and nursing home facilities are a part of phase 1. Phase 2 includes teachers. Phase 3 targets children and young adults. And phase 4 is the rest of the population with no underlying health conditions.